you seen any injection site reactions, anything like that?
I haven't. I've done now 4 cases with the vaccines, and the only caveat, you have to get it close to the site of the surgery or of the where the tumor was removed, but you also have to get it close to a lymph node.
Yeah.
So it's kind of like, all right, you know, you kind of, that's on you, kind of figure that part out. And so far it hasn't been that much of a big deal. But yeah, we haven't had anybody come in with, you know, any reactions whatsoever. None. Fozzie's mom said he goes home and it's like nothing ever happened to him, so, you know.
Are you giving it sub-Q or IM?
Sub-Q. It's a sub-Q injection, yep, Patty. Mm-hmm.
Any use in cats?
Well, it's supposedly been tested and used for the, I think you were talking about the fibrosarcoma cats.
Yeah, we've seen a lot of fibrosarcomas in cat cases, and there's been a lot of data that we have on cats. So it would just depend on the specification we're looking for, but it's designed for cats and animals.
And I guess we'll talk a little bit more about that maybe towards the end, but if it were me, and I had a cat, fibrosarcoma, I might pair that with the Biosys graft. And Mosey, the first case I had gone over, that dog had his second surgery when we grafted him, had another round of the vaccine. And he was the only one to date with a sarcoma that I've treated that is now negative for any regrowth at the surgery site. So I don't know if there's something with the 2 of them in tandem, but for most people, whatever works, we don't care. We want our dog to live. That's basically what they're after. You know, we want our dog to be with us for a long time. Yes?
So I know that this is, with mean survival times in different cancers, it's kind of tough to say, but if you have a dog that ends up having a long life expectancy after the immunotherapy is done and the tumor is removed, do the vaccines need to be boosted? Do they need additional immunosuppressant afterwards?
Typically, no. If there does happen to be some sort of regrowth, then you can do it as a precaution. But most of the time, especially on the long ones, what we've seen is that there's no need to redo the vaccine after you do it the first time.
The antibodies stick around.
Right.
And the cool part about this company is that on the 3 dogs now that have had sarcomas with regrowth, they will get you another vaccine and formulate it up for free.
Oh, wow.
So there is no charge for the, you know, if that vaccine did not work for that patient and needs to be redone, they do it for free. So it's kind of cool. Yes?
Now, those sarcomas, you had said that they came back at a higher stage. Then would you submit new biopsies for the higher stage to the vaccine companies, or do they go up to that first one to remake it for you?
Yeah, on the cases that I've done that with the stage that was, you know, presented back. So, yeah, because we sent the I think Akuma's, no, Akuma stayed at a 2, but Oliver's, and he wasn't pictured, he went from a 2 to a 3. The 3 got sent. They made the vaccine off of the stage 3 sarcoma. You know, and that is a good point, because you think, oh, it's a sarcoma, we just did it last week. That was a 3-week span between the time he had the first one and then the second one removed. And the second one was really just residual left over from the dirty margins that they couldn't take the first time around. So, you know, it's best to do the most recent if you can. You don't necessarily have to send it out to the pathologist, though, to have them read it again unless you want, because that typically is an extra charge. But if you get regrowth at the site and you take that tumor out, that tumor goes to the lab and they send it back and they give you a vaccine, and there's no charge, there's no cost for it.
How large a piece of tuber do you require?
We need about 2 to 5 grams. We have worked with something smaller, but it really just depends on each specific case. The more of the tumor we have and the larger sample size, the better the vaccine's gonna be able to combat the cancer.
You can convert that to some volume, 2 to 5, we don't have gram scales.
Let me get back to you on that, on the exact volume. What I will say is.
A lot of these tumors are large. We just, take like a quarter size. With the melanoma, the one there, that already started as the size of like maybe a grape. So I took a third of it, they got that, and the rest went to the lab. That's kind of how I did it.
Use postage scale.
I didn't weigh it. I just, there you go.
In the tumor collection kits that we would send you, it does come with a specimen tube, and it's highlighted on there kind of how much each one is, how far you're going. You really just have to fill in the specimen tube and out all the way up. Just as much tumor as you get in there, the bigger the sample size we have, the better the vaccine. Do you have another question?
I was just wondering the mesh, how it has to be stored or shelf life, or just when you need it, you order it and you get it the next day.
Correct. So we offer next day shipping. The mesh does have a 2-year shelf life, and so you can keep it, or if you need it next day, you have that as well. And what was the last part of your question? I'm sorry.
That was it.
Okay.
So on a traumatic wound with the mesh, you're going to debride that wound, and it's going to have rocks and gravel and hair in it. At what point do you put the mesh?
You want to clean it as much as you can, and then you would just put the mesh over top.
So you don't wait for a couple days of.
Correct. Just as soon as you debride it, then that's when you actually want to put the mesh over top. In specific wounds, if you don't need structural support, that's when I would use the powder, because the Helion is designed exactly for the acute and chronic wounds. The only differences between the two is that the mesh offers structural support. So if you're doing mass removal in a large area, that on the side or over a limb that you need structural support, or of that sort, that's when I would utilize the graft. Otherwise, the Helion powder is your best bet.
And Daniel, you are suturing that mesh in place. Right?
Yes, the graft does have to be sutured in place. Once again, going back to the previous case, it needs to have blood supply. It needs to be able to mimic the function of the tissue around it. The way the graft is going to work the best is you're going to circumferentially suture around the edges, and you want to pull the graft underneath where the skin currently is. You're also going to tack it in a couple places throughout the wound bed, and that allows blood supply to attract to the graft quicker. And in specific cases, it's perfectly fine to fenestrate throughout, so that way the blood can seep onto the graft and it hydrates it quicker as well.
Can you use either the powder or the graft therapy laser?
You can. So I'm glad you brought that up. If you do therapy or hyperbaric chamber, you can absolutely use them in conjunction. In both those cases, what you're doing is hyperactivating the cells around it to attract and heal quicker. So all you're doing using the graft or the powder is you're providing a matrix so the correct healing occurs. And then when you have laser therapy, it then attracts the cells onto the graft quicker. We had a case, unfortunately, I don't have it up here today, but it was a horse that had a degloving down to the bone. And after doing multiple graft implants and laser therapy 2 to 3 times a day, from the degloving down to the bone, we were able to save the leg, and it was able to regrow within 45 days. So I do want to thank everyone once again for being here today. I want to leave you guys with one question just to think about. If you were able to offer these treatments and therapies within your practice, what would that mean for you as a doctor? And what would that mean for you and your practice? Thank you again. If you guys have any questions at all, I'd be happy to take them now or speak with you down there. Here's our contact information. You can find additional case studies and photos at our website. Feel free, that's my personal contact information as well, and I'd be happy to talk with you one-on-one at any point in time.